Good morning, everybody. Welcome.
Hey,
Good morning.
Happy Friday. This is another Proactive Health Collective of Keene webinar. Thanks for joining us. We'll give a quick introduction. We are five healthcare practitioners in Keene, New Hampshire. We each have our own sort of views of things, but this is basically a roundtable sort of discussion where we can just chat about things, and you're welcome to enter your little feedback or questions, and we'll try our best to put those, to address those in our conversation. In our panelists today, we're missing two members, Doctors Matt and Tisa Abatelli. They are chiropractors at Cheshire Wellness here in Keene, and Dr. Tisa just had a baby. So we want to congratulate them, and we're super excited for them. Really adorable young boy, and we'll hope to see them in a couple weeks.
Yeah.
But we will miss them. Other members of our panel, Dr. Gene Clerkin of Monadnock Natural Health, also here in Keene, New Hampshire. He's a kinesiologist and also practices network spinal analysis, chiropractic care, and very specializes in gut health, very knowledgeable. And we have Rebecca Montrone. Her business is Wondrous Roots, and she's just phenomenal with Western herbs and nutrition and supplements and all types of different varieties she chooses from to get you feeling like your best self. I am Allison Millar. I'm a licensed acupuncturist and practitioner of traditional Chinese medicine. My business is Basic Balance here in Keene. And yeah, we're looking forward to a really great little chat today.
Yeah.
What are we going to talk about, Becky? I think
We're talking about people having confidence in making decisions when it comes to their health, for themselves, for their families. We are in, since this whole thing happened, the COVID thing happened a year ago. That's actually when Dr. Gene Clerkin said, hey, let's get together. Let's kind of like form, how do we respond to this? What's really going on and all of this kind of thing. That was really the roots of our Proactive Health Collective of Keene. And so we've been through that year. We have had, there's so much media force, influencing people as to what they should do, what they need to do, what they need to be afraid of, what they need, and we just go, whoa, Nellie, it's kind of like, wow, stop, just slow it down. It's like been a stampede of, this is going to kill you. This is horrible. This is what you need to do, blah, 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 blah. And now this is what you need to do. And so this is not new for people in our areas of health. And I would say our areas of health are very broad. We are not alternative. We were called alternative because the AMA has its only legal right to anything based on the moves they made back in the early 1900s. So we are not alternative, nor are we complementary. We are health. So somebody calls me and says, hey, I have a red streak climbing up my leg. I had a whatever, I'm recognizing cellulitis, and I'm like, you go to the ER, okay? Go to the ER. I'm not gonna say, oh, we're gonna do something different. No, I know when you need Keflex, okay? That happens. So I would just like to say we are not against what we would call modern medicine. We think, I do, I'll speak for myself, but I think it has its place. If I have a broken leg, I don't want to go see Allison, right? For needles. I want to get somebody to set my bone and, put a cast on, and off I go.
When I
been sort of relegated to we only understand certain things. And I think that's, well, I know it's not true. Yeah.
when I meet with a potential, practice member or somebody that we may work with, one of the first things we cover is this idea that you're speaking of. And we're calling this group the Proactive Health Collective of Keene. And what you're really thinking about here is a medical approach, which is okay. There's a time and a place, as you say, heart attack, car accident, that's crisis care. And then you have a more proactive approach, which really means going upstream to root causes. It means once we understand about those root causes, how can we be more empowered to operate maybe differently, maybe handle our stress better, maybe look at the products that we're using that may be toxic, maybe make a little better choices on the foods we eat. And so proactive really means about taking control of our own health versus giving our health, basically to our doctors. And again, if you're about to die and you're in a crisis mode, yes, you are saying, yep, do whatever you got to do because I'm at that point where I don't have any answers. But when you're in a chronic disease position where you have the symptoms that people have, you totally have an opportunity to take control of your own health and be proactive.
Yeah. I would like to add on to that. There are many people like us and many others. Oh, and many in, oh my goodness, every tier of medical care who have information that goes against the public narrative. Okay, so we act as though in this world, I'm sorry, but we are acting as though Anthony Fauci has some sort of corner on intellect and knowledge and precision when it comes to COVID. And so everything upstreams to him. Everything's like, well, what does Fauci say? And that is so sad because there's so much brilliance in this world. So many wonderful, brilliant medical people on, again, every level, doctors, PhDs, you name it, all down the line. And we're all saying, but what does Fauci say? So I don't know, we've been kind of held hostage here for a year. And it doesn't seem to be lightening up.
So again, in the beginnings of this group, when I saw us, this was back in March, I guess, of last year, I saw that it became really important to really get the word out to people to understand a different philosophy. And again, in that medical philosophy, it's really more about fear-based. And it's been a philosophy that's been woven in to the fabric of our society, at least over the last century. And so it's not something that just happened recently. It's something that's been going on for a long time. And even, people, we have symptoms sometimes, like we have a fever or we have something happening. Our body's trying to adapt. Maybe you have mucus and stuff, you have a cold. We've been taught to fear our body. Oh my God, this is happening. It's okay. It's not everything is a crisis. Your body can work to get better, we don't have to always be in fear of it. And I think, again, this has been woven into our fabric of our society over a long time. And so the decisions we make that might be irrational, like say taking an experimental gene therapy out of fear, that's what it's come to. So I think that's an important thing to understand the roots of it and understand how we got here and why it's such a dangerous thing.
Yeah.
I think the a strong point of all of the therapies that we practice, or maybe even not the therapy alone, but the way that we practice, the way that we spend time with our patients and we communicate and we listen and we look at the entire system and we're thorough about it. It really speaks to how we can empower a patient. And I think that it's a terrible tragedy that maybe it's the training in medical school or the insurance system, but the vast majority of physicians that practice more modern medicine, they don't have the time. And so everything is so specialized and you're looking at this one thing. It reminds me of a patient that I saw just a couple days ago, and she's been having this gum pain. And it's only happening like once every other day or so, and it lasts for 5 or 10 seconds. And she actually was told by a dentist that she has a crack in the tooth, right? So it's sort of unresolved, but it was just another thing that added on to this. She was diagnosed with high cholesterol like earlier in the year, and then had some other diagnosis with something like a malposition of her uterus or something like that that required surgery. But it was like one thing after the other. And she came to see me, and she had never had like acupuncture or seen an herbalist or anything like that. And she was just so anxious and worried because through all of these health physicians, she said, I had felt so healthy before I started getting all these diagnoses. And now it's like things are cascading, and it's like, I just felt like, she had kind of given up her whole power, and she thought that she was like good and healthy. And now it's like, I'm at the whim of all of these people's diagnoses, and they're throwing terms around. And the latest person that she saw actually said to her that she's seen some people with MS that have had this gum pain, and now they don't want to rule out MS. So that's an option. So now she's got a life-threatening disease on her plate. And, she is seemingly a very vital young woman. She's got lots of energy. She sleeps well. Her bowel movements are totally regular, no digestive problems, and I think that, and she said to me, thank God that there are practitioners like you where I feel I can come in, I feel safe, I feel like I'm heard and listened to. And I think that's such a huge part of being able to heal. And she told me, I go to these physicians and I'll tell them this is really, really stressing me out, but they just say, okay, there's no talk about that even being an aspect of it. So
I think that's usually, from what I understand in the mainstream, that is kind of a separate visit. I had someone in yesterday, she just happened to mention, I went in for my appointment and the person said to me, so we're here to talk about your cough or whatever. She goes, no, I was talking about my pain in my hip. Oh, that's not what this appointment is for. So I would say that's one thing about the way we work in our disciplines, is that we want to hear everything somebody can think of to say. I don't care how long it takes. Just please tell me anything you can think of, because people are so harried. It's like, well, that's probably not important, so I won't say that. I won't mention that. And that you don't get to know people, and you don't really earn the right to enter their space if you don't take the time to know them.
Yeah.
That's true. And, I think what Allison said before, I think is true. And I think we have to acknowledge that it's not really our doctor's fault. I mean, it can be in a way, but they're within a system that is a structure that only gives them so much time. They have to get to the next thing. They have people above them, typically, as it gets more into the hospital systems and less of private practices who are having challenges making it because of all the, insurance stuff, essentially. And so they're stuck in this system. And really, they're taught in medical schools. They're not really taught what we're talking about here. They're taught to look at these things. This is what this meant. Their education is typically coming from a pharmaceutical controlled curriculum, and so they don't know. It's like, how much nutrition does an MD take in their curriculum? Typically 0 to none, right? Like, they just don't, it's not in there. So why would they be expected to be having this conversation with people about how nutrition might affect their chronic condition? They not, it's like me trying to talk about, fixing a car. I don't know the first thing about it, right? I drive one.
Yeah.
But that's it.
Yeah.
And like Becky was saying in the beginning, that's more modern medicine. There's nothing wrong with it. It's great for certain things. But that's why we are here doing what we're doing, to show the public that there are other ways to go about your health. There are other lenses to look at it through. And there's a lot of options that you have, even if Western medicine cannot.
Maybe people, Allison, don't know your background. I know we've talked about it before, but you are a perfect example of experiencing both sides. You were established in mainstream medicine, and it was, you were like seeing children's files come in, as you describe it. And you're like, nobody this age should have a notebook this thick. And you're like, what are we doing wrong? And you could have had a cushy, hey, I can fit myself in this. I got my education, I have my degree, I have all the certification, I can just stick here. But instead, it sent you totally another way. So I think that's really a great perspective from your experience, having seen both sides. So maybe just elaborate a little bit on that, because I know people are listening who haven't known that.
Right. My undergrad was at Northeastern University. I was a biology major, and I was on the pre-med track. And I was at the college that I went to, we had a co-op program, so we could work and then go to school half-time and kind of do 6 months and 6 months. So the co-op job that I took was a medical assistant, and I worked there after college as well. So I think I was there 6 or 7 years at the same pediatric hospital. And I would work with patients there, kids typically, kids or young adults. And we'd see the same, you get so familiar with the kids that would come in. You'd know them by name because they would be there like once a week or once every couple of weeks. And it was before electronic medical records. So we had paper charts, and you'd see these kids, you pull their file, and some of them would even have 2 files. They'd be maxed out in the manila folder, and you have another one, and just dates of medical visits. 15 minutes were scheduled for the sick visits. And it was just it didn't make common sense to me that this was healthcare. These kids weren't getting better. They would just keep coming back, and you'd always see the same prescriptions being sent for, you'd see 40 kids in a day, and, out of all of them, they'd get, most of them would get like the same handful of medications. You're like, how could people be so different and all fit into all need the same prescription, right? And then you have the prescription, the reps of the company would come in and they'd schmooze with you, and they'd give you all this free stuff, and it just didn't sit well with me. And yeah, I'm very Western, sort of oriented. Being a science background, I had no idea. My parents didn't even know anything about acupuncture, anything like that. I grew up in the suburbs of New York City. And yeah, when I first started going to acupuncture school in Santa Fe, New Mexico, I think it took me about 1.5 years into school before I finally kind of trusted what I was doing and the medicine. And I would always think more was better, right? So obviously you're going to put a needle in, you're going to stimulate a response in the body. It's going to, produce enkephalins, natural painkillers, and anti-inflammatory compounds in that site. So if you have shoulder pain, we're going to, my mentality was I'm going to learn to just put needles all over the shoulder, and we'll hook up electrical stimulation to it, run it for a half an hour at various frequencies, and we'll be good. And as I was in the program, I started learning Japanese styles of acupuncture. And I'll tell you what, less is more a lot of the time. And nowadays, the way I'll treat shoulder pain is with the opposite ankle. The way I'll treat elbow pains with the opposite knee. And it's all a whole nother world. You start opening these doors, and the body works in really incredible ways that you would have no idea about.
Yeah.
So,
it's
yeah.
so interesting you say that about less is more, because I need to order some more methylfolate for my office, and I like to use a 400 microgram because folate is so necessary to so many things, but you can really mess people up with too much. So I was ordering through Emerson and they didn't have my regular Jarrow 400 microgram. And their options were like 1,000 micrograms, so a milligram folate, 5 milligrams folate. I would never do that with anyone. If you need more, we'll start with 400, we'll maybe move to 800, we'll see where that goes. But this kind of slam it all in. And this is what happened with the whole idea of folate and methylfolate and B12. Well, methylfolate, especially when it comes to what we call mental illness. But these were add-on prescriptions, Deplin, for your SSRI, right? Is like, we're gonna just slam you with 5 milligrams of methylfolate. That for so many people, it is way inappropriate, but it's how they got to get a patent on a prescription. So I agree. We go slow, and we move up slow. Because we want to provide the things that work that, as you are saying, Allison, and Jean would certainly agree, help the body start to work in a better way without slamming some big intersection into there. Yeah.
I think it's sort of like homeopathy in a way. The less that you are forcing, in like a spinal network analysis chiropractic care, where they use, if you're not familiar with that, use a gentle sort of touch. You're almost kind of just making a suggestion to the body. And I think the less that you force it to do something, the more the body has to change to sort of do what you're asking it to do, if that makes sense.
Yeah.
A practitioner, a clinic supervisor while I was in school, and I was always used to doing points bilaterally. So you do the same point on both sides and you make like an even sort of treatment. And clinic supervisors, like, you're spoon feeding them, it's not as effective basically. So, you're just giving the body, you're just doing it for it, right? You're not sort of setting it up so it can do it for itself.
Right. That's what I like about homeopathy. It kind of like is in that way almost one of the most natural ways, because you're just getting the body to do its own thing. But speaking about subtlety, Dr. Epstein, who developed network spinal analysis, one of the things he used to say in addressing that, because it has a lot of chiropractors like, like really getting in there, which is fine too. Everybody's got their different things, but with a very light touch, people, how could that make a difference? Like, well, if you've ever driven down the road and seen blue lights in your rearview mirror and notice what happened to your physiology, it's like, it doesn't take much, right? It just takes the right input at the right time to change physiology.
Right.
Yeah, that is really a good point, Jean. That's an amazingly, like, I never thought about it that way. But it's like, yeah, you can just things can be changed just like that.
Or just, like your spouse, your husband, your wife comes over and puts a gentle hand on your shoulder, and that might change your whole physiology. Like, you don't have to
Doesn't have to
on
be,
somebody. You don't have to less is more. Yeah. For sure.
I like that.
So I wanted to just, Allison, you had said something. I just wanted to bring this up because it comes up a lot in conversation, and it came up with me this past week in a consultation. Somebody said, well, this also, I went through like, well, here's what we do. We want to identify what's going on upstream. We want to get your body cleaned out. We want to do gut repair, get your digestive system working well. We want to support the organs, and we want to get you to like make some lifestyle changes to support that. Okay. And she said, that sounds good, but I just have this in the back of me, this science thing. And like, that just like always makes me go like, what are you talking about? And so I said, science, there's science is not just limited to inductive sciences that rely on studies, which can change when information changes over time. Eggs are good. No, they're not good. Yes, they are. No, they are. Wine is good. Yes, it is. No, it isn't. Coffee is good. No, it isn't. Yes, it is. All these things change as information comes in, and that's good. We use inductive science, but we have to, again, use logic as well and say, does this make sense, to me? And does it make sense? Like if it hadn't rained for weeks and, you know, the garden is suffering, the tomatoes are suffering, the zucchinis are suffering, all these things are suffering. Do you have to do a study to realize that just the garden would do better with water? You know, like, do you really need a study to tell you that your garden would do better with water? Or does it just make sense that if you were less toxic, if you ate better food, if you had less stress in your life, that would have a positive impact on your health? Like, do you really need a study to tell you that?
Yeah,
I think the more that it's like that quote, the more I travel, the less I know, but also like the more that you start learning about things, the more you realize that we have no idea how the body works. I mean, just the immune system alone, there's thousands, if not tens or maybe even hundreds of thousands different reactions that will happen and different things that are involved. And something, you know, Western medicine or modern medicine, so young, it's so young. And when you're making really specific things happen within that body to kind of control it or elicit a very specific response, there are absolutely consequences that they're unforeseen or they're disregarded and treated in different ways. It's just a scary thing to think about. You know, we've evolved our bodies over so many years to deal with things in our environment. And of course, our environment is drastically different than it ever has been. So we have to kind of account for that. But I personally think that we have so much power in our bodies and the innate wisdom that I would much rather trust my own body and its immune response than kind of some man-made thing in the recent.
yeah, funky things, funky pharmaceuticals.
Yep.
Which kind of brings us to the, Jean, did you want to say something on
Yeah,
that?
I was just going to say, because I know where you're going with this, but I want to like preface it with, you know, it is, there's a deep philosophical issue here that, you know, do we trust in this? Do I trust my body or do I not trust my body? I talked about this before, but just in nature, you know, an example is like the farmers didn't like the coyotes raiding the hen houses. So they put a bounty on the head of the coyotes, wiped out all the coyotes, and then they found that the field mouse ran wild and totally destroyed all the grain. And they upset the balance. So in there trying to fix one thing, they created another problem. And that typically happens when we're not stepping back and having some trust in like, well, how does this thing work? And when you're messing around with a very intricate system, like the body, for instance, and you're saying, you know what? Not that we know barely anything about the immune system, as Allison was just sharing. We don't know anything like really about the immune system, and now we're going to just experiment with it, you know, and trust that as science is, you know, it's ludicrous to me.
I think I'm actually probably messing with the ecosystem in my backyard. I mean, yeah, I don't know. I'm overfeeding my animals. Like water. I don't know. But
the birds are going to get too fat and they're going to get die of.
Because they are all pregnant and, you know, but whatever.
Here's what's going to happen. The birds are going to get too fat and they're not going to be able to get away from the cats fast enough. And so that's, you know, going to be their downfall. And in trying to help them and feed them, and now you've gone and done.
I do it out of love. I might be killing them in the long term, but anyway.
No, but seriously.
But here's the deal. Our human bodies, our immune systems are so intricate. They are so miraculously woven and made. It was so fun this week. Somebody on, I don't know, on Facebook or whatever, like Dale and I, my husband, went to school in grammar school. So here's a picture of us in the third grade. And you got little skinny me with my horrible bangs and all this kind of thing. Little skinny me. Probably back then, I think I had an appetite issue and I was constipated all the time. You got Dale over here. And like I said to my daughter, like, if you don't believe in God, you know, that you're even in existence. But I mean, we're kind of a motley crew, right? We are who we are. And the things that really changed my health picture were just learning about nutrients and changing that and changing all of that. When you take something as complicated as the immune system, whether it's a virus out there or a bacteria or it's a this or a that, or how are we going to, repel that? So do we need a vaccine? Do we need a this? Do we need a that? When you impose things, and they all do, I'm sorry, every single vaccine, I don't care what vaccine it is, how old it is, how long it's been used, it messes with your immune system, which is a wisdom nobody has a right to really mess with except to support it through healthy living. So now you do that, and now you say, okay, we're going to do this. Oh, goodness. Goodness, we're going to give you a measles shot, but it doesn't really work that well if we don't put aluminum and formaldehyde, because that won't create enough inflammation. So we're just going to do that so you have a better response. But we don't say, what else did that inflammation create? What else did that inflammation do to you? And why do we have a right to impose that into you? And right now, as everybody knows, we're in the COVID scare. We are in the COVID vaccine time. And I want to talk about this because I have clients every day, and I'm sure you guys do too, who are saying, what do I do? Do I get this shot? Do I not get this shot? Here's the main points I would make. COVID-19 has almost a 100% worldwide recovery rate for those who get it. 99.75% across the globe.
And much higher in children and young people.
Yeah.
That's everybody. That includes all the elderly people.
Right.
That's, yeah.
So this is the devil we know, I guess, that you get it and you got almost like 100%, you're just going to get over it. Now we've got these vaccines that were rushed to market, emergency authorization only. Most people think when they're getting a vaccination that it's going to protect them from getting the illness. It's going to protect them from spreading the illness. That criteria was never involved in the trials. And this, I think, is what people need to know. This has never been documented. It has never even been asked to be documented. So why are we doing this? You're still going to have to, it doesn't make a difference. They weren't studied for this. They weren't studied for that. We're seeing a lot of very negative outcome from the vaccines, but across the board, they're just denying any association, which is what they can do. They can just say there's no association, and nobody can have anything to say against that. Just no association. So buyer beware. And I think people need to know that there's a lot of pressure right now on people with their jobs, whether you're teachers, whether you're in the healthcare professions or whatever. It is illegal because this is any treatment under an emergency authorization use only is illegal to be demanded for you to keep your employment. So people need to know that, and they need to stand up to their employers who are forcing this, because this is a beast. These are beasts. We don't know what's going to happen with them, but we are treading into sacred soil with people's lives, and it's not okay.
So just something I'd like to say about this is, how did we get here? Again, in my training, I'm always going upstream in any situation, whether it's like, why is my kid not listening, or why is, like whatever, how did we get here? And again, it goes back to fear, right? So we're making decisions based on fear. I've learned many years ago that in my life, making decisions on fear typically never works out for me. Like making decisions on understanding and knowledge and where I want to go versus what I'm afraid of is really what works best. And, there are a number of things that I think have driven fear. One of them is recently in testing, they've turned back the amount of cycles used in testing. So as you increase the cycles in PCR testing up to say 40 cycles, you're picking up stuff that isn't really even there. And and now obviously they're admitting that because they brought down the cycles down to like 25 or something like that, right? So that says that all those tests prior to that were positive are not valid. And so we have this information that we're making decisions on, and we're fearful of it. Oh my gosh, this many people, the case counts every day, regardless of what the deaths were, case counts.
Yeah.
And so we're making we're taking that inductive information, right? That can change, that can be wrong, that can be manipulated, and making all our decisions based on that inductive information. And the deductive way of looking at it is saying, wait a second, it's not logical. It doesn't make sense. And so that's one thing, right? But there are other things too. Like why, if we're concerned about our health collectively, our leaders, or I don't even really call them leaders, just people that are in positions that they think are power, are deciding that the best route is to go the fear route, not to go the proactive route. And therefore everybody has to do the fear route. Why don't we have a nationwide collective of saying, okay, the people that are dying from this disease are, if there isn't even a disease, the people that are dying from this disease are basically sick already, right? For the vast majority of these. And if that's true, what could we really do if we really want to go solution-based? We could look at our food supply. We could look at the toxins in our environment. We could look at what we're teaching our children to eat. We could look at, our whole culture, again, is being driven by this model of don't worry about this, wait till it gets sick and we'll manage it with a medication. And that same entity, philosophy, group is directing the health, and I use that term very loosely, of the country. And why, even if you believed in the efficacy of that route, why would you not then also look at how do we get people healthy? This is a wake-up call to understanding that, oh my gosh, we have to shut down society because all these people are vulnerable because they're unhealthy. And doesn't anybody care about that? Doesn't the fact that they're unhealthy and they're missing out on their own quality of life as it is in the remaining years of their life? That's, again, you if you're just stuck in inductive science only and taking the numbers that are being given to you by entities that are for profit in this thing, and you're not using any deductive logic, that's not having a choice. You don't have a choice. You're not making a choice. You're not given a choice. So.
Right. So I think that's one of our biggest things here, Proactive Health Collective of Keene. I'm like, please think and don't feel so powerless. Don't feel like, oh my God, this thing has engulfed us. And if we just don't, and there's so much peer pressure. All right, so this is kind of snarky, but this is my recipe to share from my kitchen. The COVID Kool-Aid cocktail, all capital K's, KKK. Ingredients: 1 part propaganda, 1 part censored information, 1 part well thought out agenda, 1 part all the money you needed for all of the above. Instructions: mix and stir. Serving 7.9 billion. Suggestions: serve over ice via injection and enjoy. Warnings: may be detrimental to your health, but if you have issues, you are on your own. That's another huge point here. The things that are being promoted that you need to do to protect yourself and to protect your fellow man and all of that have no liability, none. Drug companies, when it comes to drugs, have liability. When it comes to vaccinations, they don't, which is why calling this a vaccination is perfect for them. Because if you say, oh my God, I couldn't walk. And somebody came in today, she goes, I've had several friends who had the shot and they have trouble walking afterwards, right? But they just say, oh, there's no connection. So if you think somebody's going to cover your fallout from the vaccine, forget it. You will never, ever, you will just fade away. And that's-
Yeah. You know, I guess one of the point I wanted to make that I forgot to make was that I think in trusting our bodies a little bit more, trusting that if we take care of ourselves, that we can be okay. And if enough people do that, then I think the way that they get to the place where they want everybody to be, you know, to take this, right? I mean, that's the end goal, is it not? So I think it's pretty well stated. And in order to get there, they're not going to just force people to do it. What they'll do is they say, well, you can't fly. You can't go to the grocery store. You can't do this. And so the thing is, if enough people say, you know what? Because people say, well, you know, I really want to fly, so I guess I'll do it just because it's probably not a big deal, and I'll just do it. You have no idea what's going to happen. You can't detox from this, right? There's no coming back. We don't know. We have no idea what's going to happen. No one can tell you they have any idea what's going to happen, you know, a few years from now. But
Yeah.
if enough people said, you know what, okay, I'm not going to fly. That's fine. I'm not going to fly. I'll find another local farm to get my food from, whatever the case may be. They lose their power. They lose the ability to use fear to make your health decisions for you. And so I guess if I had to make one point of all the points, don't let a system that is not designed to help your health make your decisions for you. You got to make your decisions. Don't let me make your decisions for you. Don't let Becky or Allison or anybody make your decision for you. But, you know, we all owe it to ourselves and to each other to go beyond the curtain a little bit here and think about these things logically, because the impact is huge.
Yeah.
Another point that's worth bringing up too is just, you know, we're talking about more modern medicine is so pinpointed and looking at specifics, and that carries through on so many different levels. And you can talk about the particular ingredients or the aggregates in the vaccine. And yes, they've been studied one by one to be proven that they're safe, but there's no sort of, they don't account for the synergistic toxicity. So if you put all of them together, are they still safe? From a Chinese medicine perspective, Chinese herbal formulas have been around for 5,000 years. So acupuncture is, you know, to only 2,500 years, but they've been studying Chinese herbs for that long. And they use Chinese herbology is just incredible. The things that you could do with it if you're really a great herbalist. But you have a lot of different herbs in a formula, 10 to 15 herbs on average, and they will work synergistically together. So if you were to take all those herbs at different times during the day, it would have a completely different effect than if you take that Chinese herbal formula. You have guide herbs. So say you have a formula specifically for, you know, a problem in your ankle. You're going to have guide herbs that are going to guide the more, you know, pain relieving blood circulation herbs down to certain areas of your body. They can actually target by location. You can target by organ system. So it's incredible when you look at it as a whole. But I think it's important to know that, you know, just like you go to a doctor with a sore throat, you know, maybe you'll go to the specialist for the sore throat. They're not looking at the whole sort of thing. So
I would also like to add that I think it's really important for people to understand that the so-called vaccinations right now are not vaccinations. This isn't like your next shingle shot or your flu shot or your pneumonia. This is a totally different ballgame. And so the adjuvants really aren't the problem. It's not the same thing. So understand is super experimental. We have no idea what to see, what to expect down the road, but because of the urgency of the so-called emergency pandemic, we have been, these things have been unleashed on the population. So there's a lot of pressure for people like Dr. Jean was saying, for if you want to travel, you want to do this, you want to do that. Right now in Israel, it's horrible. You can't do anything. And so we need to stand up for our rights. The Nuremberg Code really is like 10 tenets or maybe 11 tenets that say you cannot be forced to be part of a experiment, science experiment medically without total full consent. So I think there's a lot here that has to be said for people understanding their rights and not doing this because, you can't see your grandchildren because my daughter-in-law doesn't get it or whatever. Please stand back because when you take something into your body like this, you can't take it out. You can't change your mind later. And I would say for Dr. Jean and myself and Allison, my family, Dale and I can't think back decades when we last had a cold. We're sick with anything. We don't mask beyond what we have to for the, you want to go shop. We don't overwash our hands or do any of that. We don't do any of this stuff. And we haven't gotten COVID, neither have we gotten anything else. So again, let's maybe like end this on the high octave for the wisdom of our bodies and how our bodies will work for us if we treat them properly.
Yeah, and I want to just piggyback off of something Allison said earlier too about, breaking down the body into little pieces. Again, if we typically in our Western medical system, because everybody's so specialized and doesn't have time to really go beyond that in that time frame, and so you become like a thyroid. You come in and it's like you're a thyroid. That a thyroid lives in a vacuum and isn't, connected to the rest of your body. But we have to understand that the hypothalamus sends a chemical signal to, the anterior pituitary, which sends a chemical signal to TSH to the thyroid, which then sends T4 to the liver to be converted, to T3 to be used. And all the mechanisms are like that. There's stair steps through everything, and they all interact with each other. So again, when you get so specialized in that one area, you miss those things. And I always use the example of, if your thyroid was a fish and you pulled that fish out of the pond and did an analysis and it was toxic, what would you think about the other fish in the pond?
Yeah.
Like you are the pond, right? And you got to clean up the pond. And I imagine even that's on just a biochemical level. If you get into, when you're talking about a holistic way of things and how different things affect each other, when you get into the Chinese medicine realm, it just probably blows the doors open even more so on that whole concept, because now you're talking about all different kinds of things coming into play. But I also want to mention, one of my mentors used to say that the Chinese say you can't step in the same river twice. And that, there's a couple of things there. It's like, if you do an experiment, chemistry, and you have chemical A, chemical B, you put those two together in the exact same amounts and purities, you're going to get the same reaction every single time. And if you can know the reaction that you're going to get when you do that, that's called science. Because now you can put those things together, you can predict a reaction, right? If it's going to be a random reaction, then it's not science. And so each of us is a totally different set of chemicals, right? Which is why no one right diet, no one right herb, certainly no one right medication for each person. And as your body changes, you might not be the same river as you were a few years ago when you took some kind of a medication, and then you can have a totally different effect on you. So we don't, again, things are changing. We don't know enough about what's going on. We have to really, I think, honor some natural laws and marry that with our inductive sciences. But I think focus on what can I do to strengthen my health versus what can I do to fight my disease. I think it's a biblical saying, don't fight the darkness, turn on the light, right? Like,
Yeah, but
disease isn't a thing.
Loved what you said about that, as far as it's all about everybody's different and it's not always the same for everybody all the time. So you have to flow with it. But I think you said honor. I think honor was what really stood out to me. And I think we need to honor ourselves in every part of us, spiritual, emotional, mental, physical. everything. First, we need to honor ourselves. And I think when people slam something into your face, that you have to make a knee-jerk reaction, it's not honoring. There's nothing honoring about that. Also, what you said about the river, because Matt and Teese's baby boy is named River.
That's right.
And you were like, you can't get in the same river twice. So I don't know, that was sort of like kind of fun.
I can't wait to hear their, how they came about that name.
I know. But don't you remember we've talked here about the river that comes down? We've talked about that. There was a book, right? You guys know Epstein or somebody, the river that comes down or something, and I don't know, but I remember us talking about something like that.
It's all about flow, I guess.
I used to get so frustrated in grad school being such a Western science oriented person. I just wanted to know, all my teachers would contradict each other all the time, and it would be so frustrating. So I wanted to know, okay, if a patient has constipation, what point do I do, right? And then, the one person would say, well, this one treats constipation. And then the other would say, no, that one treats diarrhea, and the answer we'd always joke would be yes and more, right? It's all of the above. And I think the main thing that stands out to me from this conversation is trust, trusting your body, that if you are treating it while, in a proactive way that is strengthening the health of your body instead of going after what might be wrong with it, then your body will know what to do. It will figure it out. It'll sort itself out. You can't micromanage the system. It's just way too complicated. So just kind of trusting that your body knows what to do and taking steps that are good for you, that feel right in your body, in your mind, and trusting that.
Yeah.
And again, I think along with that, because, understanding, trust comes with understanding, I think, in a way, right? There's trust, there's our innate trust and our knowings. But, if we understand what our body's doing and we understand that it knows what it's doing, that gives you the ability to be in that trust.
Right.
And, if we think about disease, I think a lot of people think it's like you're walking down the street and out from behind the tree, oh, I got Hashimoto's. I got it. Or, MS or diabetes or heart disease or whatever. It's not things that you get. It's things that manifest out of poor health, period. There are a percentage of things, congenital things, accidents, things like that can alter people's health for sure. But a vast majority of what's happening is a breakdown of health, and then the disease is the manifestation of that. And the best way to treat anything in any situation in life is not the symptom, but is to go to the root cause of the symptom, which is we're losing our health. And the symptom is just a sign that says, hey, we need to go back to square one and actually do this. And if you do that, your body automatically knows what to do. It gets better. All you got to do is get some things out of its way.
That's a great way to wrap up, I think. We had somebody said, as a veteran, it pains me to say that I no longer recognize my beloved country. And this is a great client of mine. I think he knows you too, Jean. But, I think people are feeling a lot of pressure when it comes to making really harsh decisions. So we would say stand back. Again, trust yourself, trust your intuition, nourish your body, nourish you with good habits and food, and staying away from toxins as much as you can, and your body will stand up for you. It will rise to the occasion. Otherwise, we would have been wiped out centuries ago.
And always ask the question, why? Why?
Yeah.
Why?
Do you guys listen to Zach Bush at all?
Yes.
Yes.
highly recommend him. He's so knowledgeable, and he talks about like really deep scientific stuff in such an amazing, holistic viewpoint.
Amazing. Say that again for our audience out there, because he is
So
amazing.
Zach Bush, that's ZACHBUSH, Zach Bush. You can find him on YouTube very easily.
He's a medical doctor. He's so knowledgeable and so uplifting and inspirational too.
Yeah.
I highly recommend his talks on like the virome, and Nourish Vermont is a good one to start with as well. Talks about the soil depletion and things
Yeah.
like that. Yeah.
It's out there. Awesome.
right.
Well, thank you all so much. Thanks everyone for joining us today
Joining and
for the conversation. We'll be back in 2 weeks. Is it
2 weeks.
first?
Yep.
The
Yep.
first Friday, first and third Fridays.
Yeah.
Yep.
So, and we'll probably be without the services of our Abatelli, Dr.
We'll see how
Duo.
it goes with their nesting. Yeah.
They're nesting, yeah.
Okay.
Maybe they'll have Little River on.
Yeah.
All right.
All right.
Take care, everyone.
Seeing you too, and have a wonderful weekend. And you too, everyone.
Bye.
Bye.